Dr. Marc Harrison, Intermountain Healthcare CEO. Thank you so much for joining me today. It's nice to meet you virtually as it is.
It's a pleasure to meet you. I'm looking forward to the conversation.
So our audience primarily is the Sioux Falls business community. We reach a lot of business owners and business leaders. What kind of message do you have for them now as the presumed future CEO of Intermountain and Sanford?
Well, it's first, it's a privilege to enter this community. And I hope that the Sioux Falls community and sort of the northern Midwest as a whole understands what a gem that Sanford is. And I've admired them from afar. I think really early adopters of things like genomics, understanding the importance of population health, commitment to quality. And I love their commitment to the communities they live in. And so it's a real privilege to be associated with them. And I can't wait to learn from them.
What should your future fellow CEOs here in Sioux Falls know about you? How did you get into medicine in the first place?
Well, it's sort of a family business. My granddad was a surgeon. My dad was a surgeon. I ended up being a pediatric ICU doctor. And maybe we're just not very creative at our house, and followed in some really pretty good footsteps. My mom was a psychiatric social worker, and she didn't practice after she started having kids, but certainly helping professions were what we were all interested in our house. And I've got a sister who's a gastroenterologist, and I've got a brother who's a hospital administrator. So like I said, maybe we're not the most creative folks in the world, but I think pretty dedicated to the communities we live in. And I really look forward to getting to know the business community. My understanding is it's a really active and involved business community that is committed to the health of the community.
Your resume to me is so interesting. It literally has taken you all over the world. And for the last about 4 years has brought you to Utah. My sense is you might have had a lot of opportunities available to you when you wanted to make a move. What was it about this one that sold you on Intermountain that made you want to lead that organization?
Well, you're generous. I was able to grow a lot during my time at the Cleveland Clinic. You know, it's a large organization. It's a very entrepreneurial organization, and I didn't have to leave in order to continue to grow and evolve as a person and as a physician and as a leader. Moving to Abu Dhabi was an incredible experience, a very difficult project. I was the 5th CEO in 5 years. And let me tell you, if anybody ever offers you a job like that, you should probably say, huh. And they say, boy, this is a great opportunity. That usually means it's going to be pretty hard. And in fact, it was hard, but Mary Carol and I stayed for 5.5 years, and we loved it, made great friends, and really did something that changed healthcare for an entire part of the world. We were intending to move to London. I had started the Cleveland Clinic London project after I finished being CEO at Cleveland Clinic Abu Dhabi and was leading international business operations for the clinic. And we had actually found a house in Chelsea, and we had boxes packed, and we were actually about to label them, and off we were to go. And I got a call. I was running in Hyde Park in London, and I got a call from a recruiter who said, hey, we're about to finish Intermountain CEO search, and everyone said we should visit with you before we did that. And to be quite honest, there were probably 2 or 3 systems in the world that I would have considered leaving the clinic for. And Intermountain's one of them. Mary Carol and I were trained here in the early 90s. She's a general pediatrician. And we actually moved, and I'm a pediatric ICU doctor, as I said. We moved to Salt Lake the day after we got married in 1990 and started work the day after that at Primary Children's Hospital. And I've always been a fan of Intermountain's commitment to the community, its desire to take care of everybody without regard for their ability to pay, and dedication to being a model system, whatever that means in that particular era. And they intrigued me. I will confess, I called Mary Carol and I said, hey, Intermountain called. I think I need to talk to them. And over the years, lots of people had called, and she was pretty excited about moving to London. And she said, "This is real, isn't it?" I said, I think this is a real one. And we've been here for 4 years, and we're very happy. We love it here. And it's exceeded my expectations in terms of opportunity to grow and help the system grow and do some good, I think.
I am just learning more about Intermountain, as are many of us in the Sioux Falls business community. And one of my early takeaways was that you seem to have a very sound financial performance, particularly compared to healthcare as a whole. My understanding was margins in the range of 6 to 8%. Please correct me if I'm wrong there. But point being, certainly above what we would typically see in healthcare. How are you doing it?
We're really careful with resources, and then we spend our money on the right things, Jerry. I mean, um, people say, how do you know what people really believe in? And they say you should look at their calendar and you should look at their checkbook. And I'd say if you were to look at our calendar and if you were to look at our checkbook, you'd see on the calendar lots of conversations about safety and quality, lots of conversations um, about cost control, about how we make healthcare affordable, conversations about the public health, and how we make the communities around us better. And if you look at our checkbooks, you'd see that we clearly have a capital appetite like any big system does, and I know Sanford does as well. But if you visit our hospitals, they're beautiful, but they're not palaces to medicine. We're careful about what we build. And we never want somebody to look at something we build and say, boy, that's the way they're spending my neighbor's money. That's the way they're spending my money. And so I think we walk that balance really well. And then we're careful, careful, careful. We make good investments, and then we spend on the important things, like early days in the pandemic when big systems were laying folks off right and left. Um, nobody was laid off amongst our 41,000 people. Um, Nobody had their pay cut, and we maintained really, and we lost $400 million in revenue during this first couple months. But you know what? We were happy to do that because it was the right thing, and our balance sheet was strong. And I always say we're not a bank, we're not a hedge fund, we're not a private equity firm. We're a health system here to serve the community. And I think, it's during times of crisis is when you leverage your financial strength to make things good. And we bounced back beautifully.
And obviously, you spoke in the announcement that neither one of these organizations would be considered distressed.
At all.
Sanford also has a solid financial performance, it appears like, to end the year. Do you see opportunities, knowing what you've learned and what you've achieved, to further optimize things there?
My guess is there are always levers to pull. They existed in Intermountain still. They've existed every place I've ever worked, and I'm sure that Sanford has them as well. And I think in the course of normal business, we always look for ways to do better so that we can keep costs down, so that we can make our prices as affordable for people as possible. I think what's more exciting to me, Jody, is that I think our opportunity to grow in ways that are good for the communities we serve, but also good for American healthcare is really both fascinating and exciting. I think when you look at what we spend in terms of GDP on healthcare, so 1 out of every $6, when other developed countries with actually much better public health are spending 8 to 10% of GDP, I think it tells us that there's something not quite right. And in a lot of our estimations, it's that we're stuck in a fee-for-service driving volume paradigm and doing things that maybe are not completely necessary for patients. And one of the things I so deeply respect about Kelby and the Sanford leadership is they're very oriented towards moving towards that value-based paradigm where we can think about keeping people well increasingly as opposed to just taking care of them when they're sick. And my deep hope is that we can do that in a thoughtful, intentional, and really steady way and make a difference.
Sanford, under Kelby's leadership, has taken a lot of different approaches to diversifying revenue. I'm curious if there are any of those that you're particularly intrigued by or that you could foresee building upon.
So I'm still in learning mode, very much in learning mode. So I'll be fascinated by the Good Samaritan Society, for instance, and understanding how that fits into an integrated delivery system. Um, and uh, and I'll be really eager to hear from their leadership about their history and what makes them tick, and to see where they believe they fit into a post-COVID world. And the main reason I'm interested is I don't have any experience in that area. And I think it's really a unique and bold move that Kelby made. And I seek to understand, that's all.
One area where you definitely have experience, as we've already touched on, is internationally. And Sanford has an interesting network of world clinics. What is your take on that? And where do you see that international strategy going in this larger organization?
And again, Joni, it's very early days. So I'm speaking from a position of aspiration and certainly not from a spot of deep knowledge. But one of the things I'm really interested in is, what do we learn from how medicine can be delivered in a technology enabled way in a developing country? Oftentimes, you can both trial and find really quite inexpensive, light ways of getting very good outcomes. And then the question becomes, how do you take that and you bring that back to developed world medicine in a way that in a fashion that will help keep quality high, of course, but begin to keep costs low. An example of that that's happened in other parts of the world is the use of, handheld ultrasound machines that are powered by people's cell phones. And do you really need a huge six-figure box when you can use a $200 phone? So that's an example of the things I'll be eager to learn, is how are they leveraging the good work that's being done, which is the most important thing, but using those settings as an opportunity for innovation and greater service.
Research is another area where Sanford has made some big investments, certainly in recent years. What role do you see research playing in this larger organization?
So I think that there's great complementarity here, and I'm actually excited to explore this. Intermountain is extremely well organized around clinical trials. And because we really play as a team, and we talk about being one Intermountain, for instance, during the COVID crisis, we were able to spool up 18 clinical trials over a period of about 2 months and offer every cutting edge therapy that's out there, and do it in a way that it's good for patients and then good for learning more and contributing to the overall body of scientific knowledge. We do not do basic science work. And I understand that there's some excellent bench to bedside work being done by Sanford. And I'll be fascinated to find out how we create complementarity there and make a difference in a different sort of ways.
Readers, viewers, if you want to learn more about Dr. Harrison, I would direct you to his LinkedIn account, where he has an impressive more than 300,000 followers. I don't know how you did that, but congrats to you. I did spend some time on there. You've talked, not surprisingly, in recent weeks and months about the pandemic. And one thing that you discussed was seeing it as a catalyst for the future. I've many times called it the great accelerator. What do you think the pandemic is accelerating in terms of healthcare, and what has it validated as far as your current strategy?
So thanks, Jody. So it has validated things like the importance of digital. In early days in the pandemic, our AI-powered symptom checker was able to, had hundreds of thousands of hits, and it was able to unload our emergency departments and Instacares, so that those doctors and nurses only saw the people they actually needed to see. It's accelerated, again, the importance of digital, and we've actually had more than 200,000 downloads of our digital front door, so that people can actually manage their own health and be independent and understand how to keep themselves well. I think it has accelerated our knowledge that value-based care, which in our parlance are people for whom we take full risk. So we're paid a sum of money to keep them well over a period of time. Organizations that engaged in that kind of care actually fared very well during the pandemic. organizations that didn't, that were stuck in fee-for-service, they really tanked. And I think that we actually practice both kinds of medicine at Intermountain, but we're moving as in a very steady fashion towards more and more of the value-based model, because it seems to keep healthcare costs down, which means healthcare is more affordable while achieving really great patient satisfaction and stability for the doctors and the patients. So just a couple of examples of things that we've seen accelerating.
For sure. Well, as Intermountain and Sanford continue to work through the merger process, obviously one of the next steps is going to be establishing a leadership team and what your C-suite looks like. Help me learn a bit about you as a leader, as a manager. What do you look for in your team? What kind of qualities might we see in those that you do appoint to those leadership positions?
So, Jody, I have, in general, a bias towards scrappy, gritty people who have, and many people on my team, and I didn't even realize this until, I guess this is the third leadership team that I've put together over about a 15-year period. And I began to realize that there is sort of people have relatively common backgrounds. They come from hardworking families, and they themselves have worked hard. They're folks who have taken substantial risks and then succeeded. They are highly collaborative. I will tell you that in a conversation that 3 of my executives had with the Sanford leadership team and board about a month and a half ago, one of my leaders, our chief strategy officer, finished introducing himself and talking about the team by saying, we actually love each other. And we have no drama on our leadership team. Nobody ever plays gotcha with one another. People recognize that their voices are valid outside of their particular sphere of influence. So we'll hear a doctor chiming in on finance, and a nurse chiming in on HR, and an operator talking about medical quality, and we finish each other's sentences. So I want hardworking, collaborative folks, and I want the most innovative people who understand how to lead transformational change well. Because the one thing that the COVID crisis has also taught us is the transformation that was going on in healthcare is greatly accelerated. In order to be competitive, which means that we can serve our mission in a way that people can afford, change is not only going to keep happening, it's going to probably accelerate. And I need a team that can lead that in a positive way.
I appreciated that you were candid enough during the announcement to somewhat lay the cards out and say that you anticipate, maybe want to grow beyond this merger. You talked about getting into other markets, and I'm curious, how big could this get geographically? Are there areas that make sense to you? What's the vision for the future here?
So, Jody, as you know, and you mentioned it earlier in our conversation, Sanford's strong, Intermountain's strong, and we would be just fine over the next 5 years independently if we chose not to join together. That said, we both believe that scale is going to be important in the coming era, but maybe even more importantly, we think that this transformation towards value is what American healthcare needs. And I feel like we've staked out now Western and Eastern frontiers for a region of the country that is not yet consolidated. And we know that it's happening very quickly in many industries, but healthcare is moving really fast right now. We want to give folks, hospitals and systems, a team that they can join that is going to lead to the changes in American healthcare that it needs. Higher quality, greater affordability, and emphasis on keeping people well. And I expect that we will begin to, in a very thoughtful way, choosing the right partners and having them come to us, for the most part, fill in that map. And we'll have lily pads of clinical activity, but it should be knit together by great insurance products, tele and digital. That's what the future looks like, and that's what we aim to do.
Now I'm going to take you in maybe a completely different direction, maybe
Sure.
not. But before I let you go, I have to talk about athletics. Very much a part of the Sanford DNA. And Viewers, if you can believe this, in addition to everything professionally that Dr. Harrison has accomplished, somehow he found time to also become a world-class athlete. I have no idea how he did this. Tell me a bit about the athletic experience and the role that you see athletics in general playing in this larger organization. I'm told you were somewhat captivated by the sports complex here in Sioux
The
Falls.
sports complex is amazing. Look, I guess I'm a very much a work hard, play hard kind of guy, and I like being around people who are whole people. So whether they love art or they love music or they're really dedicated to their family, often all of the above, to their faith, to their community. Um, I think the best executives, the best leaders are people who are real people. And for me, and I don't advocate for this for everybody, sport has always played a huge part in my life. I just had my 39th consecutive year season of doing triathlons, and it's been through thick and thin, through cancer, through, you know, living overseas, through little kids, now through having young adult children. Um, for me, that's a time where people often say, "Oh, when I'm running, I have great thoughts." When I'm running, I think about running. And it's just meditative in a really positive way. And it's super real. I love going to races and doing my best and finding out how I stack up against other people, and not necessarily surrounding myself by the rich and famous or the fancy. I like people who are straightforward, hard playing, willing to suffer a little bit kind of folks. And sports have just been a great thing for me. And fortunately, I was doing them before I met my wife, and she knew that this was just part of the bargain. But then again, she walked on at Hopkins as a having never played lacrosse and ended up playing varsity lacrosse back there. So she's she's probably a better athlete than I am if we're really being frank about things.
That's amazing. All right. I think just before I let you go, maybe speaking a bit about expectations. And I think with change comes a default, no matter where you sit, in wondering, what does this mean for me? Whether I'm a Sanford employee or maybe I'm someone here in the Sioux Falls business community who has a long-standing critical business relationship with Sanford. Maybe I'm someone who really relies on Sanford philanthropically. What does a merger like this mean for me?
I hope it means, and I mean this with the utmost respect for the great job that Sanford does in the community right now. It should only make it better. And the reason I say that is as we move more and more towards a value-based. So first of all, we're not anticipating layoffs. We anticipate growth. Um, we should always be looking, just like all the people who who are business leaders, they're always looking to make their organizations more effective, either through innovation or being careful with resources. We're the same. And we will be a forever organization for your community, just like we have been for Utah. But forever doesn't necessarily mean the same. Whether it's, I mean, just look at your industry. Print has actually diminished greatly. Digital is, and real time is very important now. You've evolved, and it would be silly for us to think that healthcare is not going to evolve also. But the model of medicine, this value-based model, is really predicated on the idea that keeping people well is important. And we now know that, and we should have known this forever, but we haven't as an industry. That means that people need to have good food to eat. They need to have roofs over their head. They need to have transportation. They need to have connectivity. They need to have stable jobs. And in my mind, that means investing in the community. And we actually at Intermountain have dedicated about $120 million to be deployed over the next several years in social impact investing. So things that we will get a return on, but not the same kind of return we get if we were to put it in the stock market, and that's fine. But we also get a social return that by extension, in the kind of model of medicine we have, is also good for business. So it might be in a supermarket, or it might be in a training program for people who are going to work in the food industry, or it might be in affordable housing, which is actually a very large problem in the part of the world I live in right now. So I think the business community should look forward to the ongoing commitment they've always had from Sanford, plus hopefully new opportunities for us to collaborate together.
Good to hear. Any other message that you would like to share with Sioux Falls or with the business community before I let you
I think our world is divisive right now. It's politically divisive. People are polarized. People are angry. Um, People are cynical at times and negative. I'm extremely optimistic, and I think healthcare is going to be better in the future. It will be of higher quality. It will be of lower cost. It will be delivered differently. Intermountain and Sanford are perfectly poised to be part of that positive change. And I hope we also will be a place where people can have civil dialogue about really important things that transcend politics and are really about the health of our community. And I look forward to being part of that dialogue.
go. Absolutely great. Thank you so much for joining me, Dr. Marc Harrison, CEO of Intermountain Healthcare.
Thanks, Jody. What a pleasure. Thank you.